healthresourcedirectory.org.au. Patient Fact Sheet. Psychotic disorders in children and young people. What is it? Getting a diagnosis of a psychotic disorder will depend how long, how bad, and in what ways the child has displayed any of the above symptoms. There are a lot of conditions which can look like a psychotic disorder, such as autism or bipolar, which need to be ruled out. Psychosis happens when someone begins to have any of the following: delusions, which include strange beliefs or paranoia; hallucinations, including seeing, hearing, or feeling things which are not there; disorganized thinking, such as they keep jumping from one topic to another and they do not make sense in conversation; changes to the ability to move or use facial expressions. This can sometimes become catatonia, where the person is unable to move at all. Negative symptoms, which can include low mood, low energy, and not taking care of themselves. There are many different types of psychotic disorders. Delusional disorder, having one or more delusions for more than a month, but otherwise being fine. Brief psychotic disorder, having one or more psychotic symptoms for less than a month. Schizophreniform disorder. This has all the same symptoms as schizophrenia, but lasts between 1 and 6 months. Schizoaffective disorder. Psychotic symptoms that don't go away, as well as a major mood disorder, depressive or manic. Schizotypal personality disorder. Difficulty in making friends and understanding how they impact on others or why people do the things they do. Schizophrenia. Someone who has been having psychotic symptoms for at least 6 months or less if they are being treated, and it is making it hard to function. What will my GP do now? Your GP may refer your child for treatment. Mild to moderate depressive disorders can be treated effectively with early intervention. A referral does not mean your child is seriously mentally unwell. If it is possible that your child may be diagnosed with bipolar, your GP may refer you to a specialist for an assessment and treatment. Your GP may also refer you to a counselling service so your child may learn how to manage their depression. Refer you to a family service to provide family support. Refer you to a specialist service if the depression is severe or if your child may need medication. Your GP will want your child to come back so they can check how they are improving. If they are not improving, your GP may discuss other options to assist. What questions should I ask my doctor? There is a lot going through your mind, and it can be easy to forget the questions you may want to ask your GP. Here is a list of questions you may wish to ask. What can I do to help my child now? What can I do to help my child over time? When should I make other appointments? How quickly can I expect results? What happens if my child gets worse? What can I do? It is important to support your child in learning how to manage their mood. Treatment can often take time. Some of the things that you can do include getting treatment as early as possible, as it helps prevent any depressive disorder getting worse. Provide reassurance and support to your child. Follow through with any referrals made by your GP, including counselling. Look after yourself. You are the child's main support, and it is easy to forget to maintain good self-care. What supports are available? Public health and other free services. The Infant, Child and Adolescent Mental Health Service, ICA-MHS, provides specialist treatment for children and young people up to 18 years of age. Talk to your GP about this service. The Primary and Community Health Psychology Service provides free psychological assessment and treatment for children up to 12 years of age. Contact them on 8788 4200 and ask to speak to the psychology intake worker. The South Western Sydney Local Health District Youth Health Service provides free counselling to youth aged 12 to 21 years. Contact one of their centres and ask to speak to their intake worker. The Corner Youth Service in Bankstown on 9726 8633. The Fairfield Liverpool Youth Health Team on 8717 1717. Trackside in Campbelltown on 4625 2525. Headspace provides bulk billed counselling services for young people aged 12 to 25. Contact one of their centres to make an appointment. Bankstown on 9393 9669. Liverpool on 8785 3200. Macarthur on 4627 9089. South Western Sydney Primary Health Network Mental Health Services provide 2 services to improve access to mental health services for children and young people. Staff for Kids is for children aged 3 to 12 years, and You in Mind is for young people over the age of 12. Both services include criteria to be met and require a GP referral. Speak to your GP about this service and whether a referral would be beneficial. Private options. There are many private specialist and allied health providers that can treat child anxiety. Speak to your GP about rebates for treatment. This information is to be viewed by someone who has received a diagnosis from their doctor. It is not designed to be used to diagnose a condition or as a substitute for ongoing medical care. Health Resource Directory fact sheets are endorsed by South Western Sydney PHN's Community Advisory Committee and local GPs.